Good morning or almost good afternoon. So it's been a busy week here at the Texas Capitol. We've got a lot going on. Particularly, we've hit some roadblocks with our House Bill 2444 by Representative Roberts. One of the challenges that we've hit is that the TMA folks and physicians in the House have been working hard to keep that bill from moving and have raised some concerns within our bill sponsors' mind. Our bill sponsors made a decision to remove strep out of the bill. We'd hoped we could keep that in the bill, but ultimately it's in our bill sponsor's hands, and we're happy to continue to work with him and to help get the bill through. There's still a lot of great pieces in that bill, particularly you would still have the authority to do the flu test and furnish flu medications. You'd still have the authority to furnish non-diagnostic medications that would include travel medication, prenatal vitamins, smoking cessation, vitamin D, and hormonal contraceptives. So a lot of great opportunities still there. And probably one of the biggest pieces we don't do enough to talk about is dealing with the requirement in the bill that would require the health plans to pay you as pharmacists when you provide services. It's a blanket coverage, does not include just the services we're talking about in this bill, but all the services that you can provide within your scope of practice today. And it's really tied to the fact that if a health plan is paying another provider to provide that service, then it would require the plans to pay pharmacists as well. Unfortunately, the plans over time have not made the decision to pay you for the services you can rightly provide today. We don't need expansion of scope to do these. These are things you have the authority, just like these CLIA tests. Many of you could do these tests today within your pharmacy. You may not be able to furnish the medication based on the results, but you can do the test for the patient, give them the information, and help them to get it to their general practitioner or another specialist provider so that you can help them with their health care, but you have to charge them out of pocket. This bill would require the health plans to actually pay you for those services. It's a huge piece of the bill, one that we don't do enough talking about. Some of it for political reasons. We really don't want it to be tied, this bill to be tied to a financial piece, though it's obviously important for pharmacists, for you to be able to do these services, is to get paid for them. You can't do things for free. And it's important to note our House Bill 2608 by Representative Lozano. This is the one that would recognize you as a provider in Texas. It's really a belt and suspenders bill for us in Texas, is considering the fact that you are already considered a healthcare provider in Texas throughout Texas statute. This one just adds a clarification into your section of statute defining you as a healthcare provider. Really, in many ways, is a declaratory statement by the legislature. But we're really working House Bill 2444 and 2608 together. They're both in the Public Health Committee. We really need to get them both up for a hearing so that it can continue to move through the process, which means we need you. We need you to reach out to the Public Health Committee, particularly if you're a member or a constituent in a member's district. We need you to let them know that you want them to support House Bill 2444 and House Bill 2608. And we want them to help push for it to come to a hearing. I've been working the rooms and the members' offices trying to help get it set, but I need you. It's always important to have the reach out from the constituency supporting legislation. So make sure you're sharing this with your friends, your family, because only with all of your support can we have a shot at getting these bills through. We've also hit some other challenges with the bills, but we'll continue to work and cover those angles. So let your groups know, all your different organizations that each of you may be a part of, that you want them to help push the bill and that it's an important bill to you. It really is about advancing the profession of pharmacy. So we'll keep you posted. Also up this week, clawback made it out of the House committee and sent to local and consent, as well as the MedSync. So our other organizations are doing some great work on those bills, getting them moving through the process. So we're going to keep pushing those, and we want to continue to keep you posted as what's going on. Also up this week was your sunset bill. Your sunset bill went up before the Public Health Committee on Tuesday. It was a quick, easy hearing for the bill, which is always good. You don't want a lot of discussion. We'll continue to monitor that. We'll continue to push that through the process and address the one real concern in the bill, which is the requirement for pharmacists to check the P&P before you dispense a medication.